Hi, I wanted to welcome everyone to the class. I think everyone knows me. I'm Krista Perry. Well, I think we had everybody last semester for 692. I'll be the instructor for the didactic content and the clinical instructor for the Southeastern students, and Dr. Abby McNeil will be the clinical instructor for the U.S. students. Um, our official dates for class are May 20th through August 18th. For Southeastern students, that means you have until August 18th to complete clinical hours. UL students, please confirm that with Dr. McNeil. There are three holidays I listed on the schedule: Memorial Day, July 4th, which is actually July 7th, and then June 19th. For Southeastern students, that means the university is closed, so you can't do clinical on those days, but you can do clinical Monday through Friday for the rest of the semester. And then on the weekends, you just need to get approval from me before you do that, so I'll make sure I'm available. I got access to the class on Friday, so I'm still adding a few things to the course. I did post a schedule, so take a look at that when you get a minute. The focus of the course is the older adult, but we will discuss a few other things in the course. Um, at this point, you should have a good understanding of diagnostic criteria and common treatment options. So we'll review that, but we'll also focus on some other things when treating the older adult. Um, on the syllabus, you'll see that it has some verbiage about the required textbooks are the ones you had in previous classes. That's true, except for the y'all's class, because we used the Tutti book for one semester for 691, and I'm pretty sure that was with y'all. I wasn't a big fan of that book. Some of the other faculty like it and still use it, but I'm not a big fan of it. And so when the new edition of Kaplan and Sadek came out, uh, um, started using the synopsis of that. And so that's what we use for this class. And I put that link in the course. Southeastern students, you should be able to get it free as an ebook, and UL, if you contact your library, you might be able to get it free as well. Um, the Tootsie book did not have too much on the older adult, and so I added some additional resources, and I kept some of those in there. I made a few changes from last semester or last summer when I taught this, because I talked to a few psychiatrists I worked with a few weeks ago, and I asked them what they were looking for in a new grad. Some of the content of the course is the same for non-NPs as NPs, but I don't consider y'all a new grad. So I wanted to make some changes for this course a little bit. One of the docs said that he did not feel like y'all had enough clinical experience that was active or independent, and it was all observational. That's not exactly true for everybody, but it may be for some people because of EMRs and billing issues with preceptors. And I understand that it may be more observational than you would like, but if you can be more independent this summer with your preceptors, I think that'll benefit you. Another doctor thought it was important that all of you know the major research that has affected psychiatric care or guides psychiatric care, such as STAR-D and CATIE and ACEs. Most of y'all know about these studies, understand these studies pretty well, I believe. Y'all have written some things in your papers that I've seen last semester at least. But I will integrate some of that in this course just to make sure we have some up-to-date information on that. But the thing that got me most interested in changing the course was one of the docs was chief resident at his residency program, and he's been out of school 2 years. He said that when he had a new resident, they would come in and they would be able to diagnose okay, but they wouldn't know what to do after that. And that was one of the biggest issues I had when I started out as well. I could identify somebody had major depressive disorder, but I didn't know what to do then. Like, why would I pick Prozac versus Lexapro versus Wellbutrin? And so a lot of that is personal experience. A lot of it is your own preference, but you need to have a plan. And I think it's very important. So what I did is I changed one of the assignments to integrate that. Of course, it needs to be evidence-based information, but um, it's good to have a plan when somebody walks in the door of what you're going to do. If they come in and they're depressed and they're not getting out of bed versus they're depressed and they have high anxiety. So I made an assignment to help with that. It's going to take the place of exam 2. We'll still have 3 exams. We'll have exam 1 and exam 3, which will be very similar to what I've had in 692, which is 50 multiple choice questions. And that will cover modules 1 through 9. But exam 2 will be an essay type exam, and I'm going to give some detailed information before the exam, obviously, but I'm going to have you give me your personal treatment plans for specific diagnoses. And it's not going to be that one, that test 2 is not going to be proctored by Proctor U. Exams 1 and 3 will be, and I'll let you know when I get those set up, what you can schedule. But exam 2 is going to be an essay type exam. It's going to be something you'll turn in. You can use some resources for it. I'll have a specific grading rubric for it, and it'll have a due date, but you're going to be able to work on it a couple of weeks, and I'll post that a couple weeks before it's due, so you'll know exactly what I'm looking for. Obviously, I don't want you to cut and paste a treatment plan. That really doesn't do you any good. I want you to come up with some specific examples and use that in practice when you graduate, which is going to be just a few months from now. Let's see, what else? There's an assignment called a personal growth paper. I've opened that module, and you can turn that in anytime before the due date, which is August 11th. It is a paper for you to just think about where you've been over the last 2 years and what the future looks like. Let me go back. Before I get off the topic of exams, remember that you will still need an 84.5% on the total of all 3 exams to pass the course. Okay, the blogs and reflections are going to be a little bit different this semester than maybe you had in the past. What I've done is I have developed some kind of case studies, not all the details of case study, but kind of a scenario, and you will have to come up with a treatment plan for the patient, and then critique your classmates' treatment plans. And they are vague. That's the whole point of them, because when somebody comes into your office or the ED or the hospital, you don't know all the information on day one. And so you have to figure things out and figure out, do I need to order some labs? Do I need to hospitalize them? What needs to happen? And sometimes we have to call family members, so I want you to integrate all that into the treatment plan. The recovery model paper is due on June 15th. That'll be here quickly. There is a detailed post in the class about what's required for that. Let me know if you have any questions. We're going to start with that module, but the paper's not due right away because I didn't think it was fair to give you that assignment day one and then expect you to have it finished in a week. So it'll be due in June 15th. So that gives you a little bit of time to work on it, even though we'll be finished with that module. There's a formal paper in the class, but it'll be a little bit different. It's not diagnostic and treatment. It is a paper to identify any gap in practice you may see, and that may be in your personal practice or in the practice where you're doing clinical work at. And there is a detailed page in the course telling you what to do with that. The other thing I wanted to a couple of things I want to talk to you about is student evaluations. I look at those very carefully when y'all fill those out. I appreciate when y'all fill those out. I like to hear the good and the bad and the ugly. Some things I can change, some things I can't change. We are 100% online, so I can't ever make a mandatory lecture or mandatory class because of the way the class is set up as 100% online. That being said, I've tried to add some things in the course, PowerPoints and different videos and different things we can do so we can all learn in different ways. I'm open to any suggestions that y'all have. You can either email them to me if you fill out the SEI at the end of the semester. It'll come to me late semester, early the before the next semester, and those I don't have names or anything on that. Um, let's see. Like in 692, I'm not super detailed in the testing, and the reason is because I don't think that you're going to be able to know every detail about every diagnosis and every lab and every medicine at this time. And so when you get out and practice, which you already do now, you'll be able to hopefully go back to the resources provided to you during these courses to review something or look something up or see what's up to date. What's changed. I use Up to Date. I use NEI. I use Hippocrates all the time. I ask my colleagues all the time about different things that come up because I think we always need to be learning. Let's see. Oh, the last thing I want to talk to you about was AI. We had a CE last week. The Southeastern faculty did. We had a CE last week, and there were a lot of questions about AI and how we use AI to teach and how it can be integrated into our classes. There's a lot of questions that need to be answered, and it's a big change, and we're working on that. I I don't have any doubt that it's going to be here to stay. It's going to be part of our future, and we're going to have to learn how to use it to our advantage. And some people in the course were saying, oh, people are going to cheat using it, and hopefully that is not what the purpose of AI is. Hopefully we can use it as a research aid. We can use it as a shortcut in some ways. We can use it some people are using it as um, personal assistant to send emails. That's all okay. We just need to make sure that we know we're responsible for that information that goes out. So if you put it out there, then it's considered yours at that point. Of course, if you use AI for research purposes, you need to make sure that you cite the information, just like every other class you've been in. If it is not your original thought, you need to cite it. Remember that if you put in a topic, if everybody puts in the same topic into Chat GPT, possibly it could spit out 7 papers that are exactly the same. So make sure you edit those and you understand where the information is coming from. You understand the material, and it's your work. But I do think we're going to be using it in practice as well in education. I know there's several, not just one. There's several new apps out now. One of my colleagues was sharing with me that you can record your session with a patient and push a button at the end, and it goes into Epic as your note, and it develops a treatment plan, and it can be just with one button put into Epic as your note. Make sure if you're using those applications, make sure that you understand that it's a correct treatment plan, that it's a logical treatment plan, and it's safe for the patient. There's lots of questions that needs to be answered by using AI in the medical world, but I think we're going to discuss that in the future for a long time. And that it will have its place, but just make sure that you're safely practicing. As usual, if you have questions, you can email me, you can call me. I'm in the office on Thursday afternoons from 12:30 to 5, or about 12 to 5. I also have office hours on Wednesday mornings, virtual. I am going to be in town all summer except a few days, but I'll have my computer with me on those days, and so it won't interfere with class. I just won't be in the office on Thursday. Let me look at the exact date of that. Thursday, May 29th. I won't physically be in the office, but other than that, I'll be here this summer. So if y'all need something, let me know. Y'all are almost finished. I know y'all will be glad. Let me know if y'all have any questions. Thank you.